Hi, everyone. This is Jane with the Mommy Index, interviews with my favorite businesses. And today we are interviewing Becca Campbell with Integrated Physical Therapy. She is a expert physical therapist specializing in pregnancy, postpartum, all things pelvic floor. So thanks for being here, Becca.
Yeah. Thanks for having me. I'm excited to be chatting.
Awesome. So yeah, Becca, tell us a little bit about yourself and what it is that you do.
So, you did a great job introducing me. I'm a pelvic health physical therapist. My specialty, though, and my passion is prenatal postpartum. And we do all kinds of stuff. That's not the only type of PT I do, but like I said, it's my favorite. And we look at, of course, the pelvic floor, but all over the body just to make sure that mama's in working order and that you get to live the life you want to live. And I think I love to think about it from a point of what do you want your life to look like and how can I help facilitate you getting there? So,
I love that. I think that's so great that you're not only kind of helping women, heal their bodies and the mechanics, but helping them kind of get back to the life that they want to live.
yeah, which looks different for everyone. So it's always nice to just, hang out and have a chat and be people together. That's part of why I went into PT is I have a sister who's an MD and she got to spend such little time with her patients. And that just didn't, I don't know, that's not what I wanted for my practice. Not that everyone has that scenario, but I really, really enjoy getting to spend, 30, 40, 50 plus minutes with people. And I learn about their lives and their families, and I get to see cute baby pictures, and it's kind of the best.
Mm. That's awesome. Yeah, I love that every time I had an appointment with you, we really got to connect outside of kind of that patient doctor experience and really kind
Yeah,
of see the whole picture.
I'm so glad you felt that way. I felt that way too.
Would we be able to like circle back a little bit to pelvic floor?
Yes.
Because I feel like before I became pregnant, pelvic floor was like this mysterious buzzword that I just didn't really understand what it was. And I feel like
Yeah.
maybe when I was pregnant until I saw you, I still didn't understand what it was. And so I don't know if there's, if you could touch on that a little bit.
Definitely. This is actually one of my favorite questions because I do think it's kind of this nebulous thing what the pelvic floor even is, what it does for us. And I mean, to keep it super simple and look at it from a bigger picture, among other things, we think of it as the basement of your core. So, kind of like this foundational piece of you that not only is hyper relevant during pregnancy and when you're trying to get baby out of you as well, but it supports all kinds of pressure systems in the body. Of course, the obvious things like, keeping you from leaking urine or stool or other things. But it's also super fun and awesome and important for other things like orgasm and general well being during exercise to make sure that you're pressurizing right and taking care of your body. Um, but it acts as a support system. And sometimes in the prenatal postpartum process, it can be damaged for a number of reasons. And I think a lot of the things that they tell women just happens during pregnancy is not how it should go. And it's important to me that women have access to information of, yes, while these things are common, common doesn't always equal normal. And the pelvic floor is a perfect example of that, like the damage that can be incurred and what people just learn to live with because one or more providers told them that's just how it is after you have a baby, after you reach a certain age, all of those things. Well, I'm here to tell you that's not the whole truth and that there's definitely something to be done about it. But even beyond getting rid of dysfunction and pain, there is a whole world outside of that to getting it to work for you. And like I said, in other more pleasurable scenarios as well. So it's not just all about rehab.
Definitely. And I feel like one of the major lessons I learned from you during my pregnancy about pelvic floor is that for some reason, like in all these pregnancy blogs and online resources, it's always like do 20 kegels a day to prep for birth. and they're all telling you that you need to be contracting. And what I learned with you is, because you actually did a legitimate examination and consultation on my body, I was like, you taught me that I didn't need to do Kegels. And so that was like a whole other myth you debunked too.
I'm so glad you brought that up because that's such a common thing that I see in my practice is whether it, like you said, from a blog or even other healthcare providers, they say, oh, well, you just need to basically Kegel all day long for the duration of your pregnancy. But the other flip side of that is when it comes time to laboring, you have to be able to do the opposite of a Kegel really well to get that baby out of there. And if that's the sole focus of your prehab or your prenatal therapy, you often run into problems with being able to let go fully enough to have a successful experience.
Yeah, definitely. And the last thing I think my experience with you about the pelvic floor that was debunked as well was how, so my birth was a cesarean birth, and I always thought that that meant my pelvic floor wouldn't get affected since I'm not actually pushing baby out through the vaginal passage.
I'm so glad you brought that up, Jane. You must have been doing some little like brainstorming for the perfect questions or comments because that is a weight you carry, and of course it's a labor of love, but you've got that baby in there for 9 months. It's not like just because it didn't come through vaginally that you didn't have to deal with that weight and that pressure and that change of how you moved and worked out for quite a long time. So I think that not only do you offer up a valid point about that, but also with C-section delivery, that's a whole other area that you just want to make sure is working the way that you want it to. So good on you.
Thank you. And yeah, you've been a huge component of my healing process in recovering from my cesarean experience, and that's been a whole rabbit hole that we could talk about too. But just to stay on point, I'm going to kind of go back to you, and how long. If I repeat myself, I'm sorry, but how long have you been doing this particular type of physical therapy, and kind of what's your exact training?
So, as it stands now, we all have to graduate with a doctorate. It used to be a master's, and before that, it was just a bachelor's. And it kind of, there are more and more things that they wanted out of physical therapists in terms of anatomical knowledge. Um, so, my specific training is a doctorate in PT, but postgraduate, I went and specialized in pelvic health through an organization called Herman and Wallace. They are starting to offer residencies like they do for MDs, but that's still kind of in its infancy, and they're not. I don't know. There are some arguments for and against that. So this is just kind of continuing education certification that I had to get after I graduated, just because they graduate you a generalist. And to be very blunt, the amount of pelvic floor clinic time you get is pretty small, if there is any at all. So anyone you want to see who has a concentration in pelvic health has had to not only finish their doctorate, but go beyond that to get the specialized training. And I pretty much have been doing this since I started doing PT. I've always done a mixture of orthopedics as well, but this has really been my passion and my favorite, and just where I feel I can make the most difference in people's lives. I mean, it's nice to think about, oh, I helped that athlete get back on the field, but it feels pretty good when you can help someone stop leaking urine after they have a baby. And then you get to go and live your life again. It doesn't feel like there's anything more direct and meaningful to me than that.
Yeah.
Did I answer your question? I don't know.
Yeah, definitely. Yeah, and I feel like, yeah, you kind of answered my next question, is like why pelvic floor, and I don't know if there's anything else to kind of what you just communicated, that it's really helping people, making an impact on their lives.
I also just find, and you and I have talked about this a lot, but um, how much they normalize this type of dysfunction, or how much they explain it away, or just tell you that this is how your life is now. And that, without risking getting on my soapbox too hard, that is not reality. There's plenty of data and literature and a million other things to suggest that this is not what it has to be like. And just because you had a baby, or just because you had a tear, or whatever, the list goes on, does not mean that there's not something to be done. And I think a lot of people assume, well, oh, it must be some medication or surgery, etc., or nothing, or I just have to kind of put up with it. And there is such a dramatic spectrum in between those two things to investigate, that I think it's part of a bigger problem of women's health issues kind of taking the back seat to some other things. And it is no small feat to grow a human inside you. So of course the rehabilitation is not going to be a small feat either, but it is something that can be done, and I'm happy to see that that information is spreading more and more.
Yeah.
Thanks to you.
Well, yeah, I'm just so happy you brought that up about like women's issues and women's health's not being highlighted more, because I feel like it's just kind of like assumed like, oh, it's this thing, this rite of passage women go through, and like there's no necessity for them to bounce back or heal. And like even like in movies, like you see they make jokes about like it'll show like 40-year-old moms and they're like in a workout class and she's like, oh, I'm leaking, and like they're
Yeah,
laughing about it, and it's just kind of like we get kind of swept under the rug, and like it just comes with the territory.
right. I love that you use the term rite of passage, because I feel like that really captures this idea of, oh, I don't even get to complain about this, or the only time I can address it is when I'm joking about it, like you said about the movies, the classic movie scene, which is everywhere, which only helps to further perpetuate the normalization of something that isn't normal. Um, that's always a moment when I'm watching a movie where I just kind of heavy sigh to myself. But it also speaks to the universality of this. Like, this is something that, if only we would talk about it more, would we realize that this is something that many people deal with. And maybe if we destigmatized it a little bit, then it would be easier to talk about how, yes, there is something that can be done. So we'll see.
Yeah. Well, hopefully we're doing it right now.
I love the idea of that.
um, and maybe we can do a different episode in the future talking more about the cesarean side of things.
I'd love to.
But for time's sake, my final question for you is, what's your favorite thing about working with first-time moms?
Oh, gosh. I come from a family of educators, and I feel like it's such a fun gift to be able to talk to people about how much their body is changing, and that there are all these like incredible things and tools that you can use to re-find yourself and re-embody yourself after baby. And I mean, of course, getting to see a ton of baby pictures is a perk. And sometimes when folks bring their kiddos in too, but I just find that that's an area where there's a bit of a gap in terms of care. There's the movement around the fourth trimester, which I'm so happy is a thing, because it really, really is a reality that that's kind of where care drops off for a lot of people. And it just brings me so much joy and meaning to know that I get to be part of filling that void. So that might be it. And just, how silly we can be, and when people stop taking themselves so seriously, and like you and me, we can just kind of laugh and do the therapy at the same time. It just makes it so much more meaningful.
Yeah, definitely. Well, I think a huge part of why I love working with you is that you make it so easy and comfortable to undergo a process that it can be very vulnerable and uncomfortable, because it's like the most sensitive area of our bodies and our
Yeah,
lives. And you just make it so enjoyable. So
that's
I'm just so
truly the biggest compliment you could pay me, because I really recognize the vulnerability of the postpartum place. And I feel so honored when people are willing to share that with me.
Yeah. Hmm. Well, when is the best time that you recommend a mom or an expecting mom should start seeing you?
So it depends a lot on how you're feeling. I think that if you're having this super easy, pain free pregnancy, that you're one of those unicorns, then it's kind of up to you. Even if you're not having pain, though, it's never a bad idea to come in and just be checked for diastasis recti or other sneaky things that might lead to pain postpartum, even if you don't have it during pregnancy. We can also give you some simple things to just keep you healthy and strong as body starts to change. So that could be as soon as you find out, even if it's just for a consult or two. But if you have pain, don't wait. Schedule tomorrow. There's something to be done, even if it's just hands on treatment for a while we try to figure out the rest. And then postpartum, I recommend that as soon as you have your 6 week, that you come see us just for us to check in pelvic floor wise and screen you for ab separation, the whole thing. And honestly, if you are having pain elsewhere, it can be even earlier than that. It's just what you're comfortable with.
Yeah. Yeah, I think I saw you 6 weeks postpartum and I was cesarean. And yeah, I just think it's made a huge difference on my wellness journey because I hear about other mamas, other cesarean mamas where like they don't like, it's been a couple years for them and they still feel like they are struggling with the healing journey. And
Oh,
I'm
yeah.
just I'm 7 months now postpartum and I'm like, well, I kind of, I was able to start on it right away. And now I feel like it's just made such a huge difference. So,
I'm so happy to hear that.
yeah. Well, thank you so much, Becca. I'm so grateful that you've been here.
It's been a pleasure, Jane, as usual.
And what's the best way for prospective patients to contact you or find out more or get a hold of you?
So you can call the clinic, you can send our front desk an email, you can email me directly. I often have people calling and asking if I can just give them a quick phone call about, am I appropriate for pelvic floor PT? Or, is this something that I should start with a consult with my MD or my OB or whoever it is first? So I'm happy to field those inquiries, whether it's by phone or email. And I'm assuming, I mean, you can put that information up wherever. But yeah, I think a good place to start is if you're wondering if we're a good fit for you is our website. It's always nice to just peruse. And if you have any follow up questions, then we are here for it.
Awesome. Great. Well, thank you so much, Becca.
Oh
And
my God, yes.
yeah, Jane with Mommy Index and interview with Becca Campbell from Integrated Physical Therapy on one of our favorite businesses. Okay, well, take care.